Welcome to this very special event designed and sponsored by the FAANS. These events are designed to be a 30-minute interview with some of the most important neurosurgical luminaries in our field. Today's guest is Jacques Morcos. Today is April 24th, 2023. I'm Greg Zipfel. I'm the professor and chair of neurosurgery at Washington University in St. Louis. Today is a very special day for me to have this interview with Jacques, who I've known for well over a decade. I first met Jacques when he was an outgoing fellow at the University of Florida with Dr. Art Day, and I was an incoming intern at the University of Florida as a neurosurgical resident. Later, I worked directly for Dr. Morcos and Dr. Harros at the University of Miami when I proudly served as their cerebrovascular and skull-base fellow from 2003 to 2004. I went there to polish my complex surgical skills, but I left there with so much more. I was provided amazing mentorship, learning much more than surgical anatomy and technique, and made lifelong friends with Dr. Harros and Dr. Morcos. Jacques has also played an outsized role in my career in organized neurosurgery. He really was the first to open doors for me in the joint cerebrovascular section, which was my first entree into organized neurosurgery. So Jacques has had an incredible impact on my career, all stemming from my 1 year as his fellow in 2003 and 2004. So thank you, Jacques, for being here with us, and it's an honor to speak with you today.
Thank you, Greg, and I'm delighted to be sitting here with you and to carry on your story. You've made me so proud, not that I'm the reason behind your success, but it was very clear from your days as our fellow that you will be the superstar that you are today, leading this spectacular department at WashU.
Thank you, Jacques. That means a lot to me. So to continue the introduction, Jacques Morcos is the professor and co-chair at the University of Miami in the Department of Neurosurgery. He's the director of skull-base, endoscopic, and cerebrovascular surgery there. He's also the division chief of the cranial service. He's the past chair or president of numerous organized neurosurgical organizations, including the CV section, the North American Skull-Base Society, the Society of University Neurosurgeons, the World Association of Lebanese Neurosurgeons, and most recently served as vice president for the FAANS. Outside of those titles and roles that Jacques has played, to me, he's the following. He's an exacting anatomist. He is an otherworldly technical neurosurgeon tackling some of the most difficult cranial surgical diseases that we face. He's an absolute dedicated educator and mentor. He's a national and international leader in neurosurgery. He's a humanist in the field of neurosurgery with an uncommon eloquence and ethics. And I really think he's become really our global ambassador of neurosurgery and a role that I know he embraces and something that we very much need from him as we are working to connect the entire world of neurosurgery. And he's a very big and important player in that field. So with that, you're not from the United States. You had kind of a circuitous journey to where you stand today. I thought we'd start with you explaining your journey to the United States and your journey to American neurosurgery.
Absolutely. I was born in Latakia, Syria, but my parents moved when I was 4 years old to Beirut, Lebanon. My mom is Lebanese, my father was Syrian, and I grew up essentially in the middle of the Lebanese war that was from 1975 to 1990. My early influences regarding neurosurgery is Fuad Sami Haddad, who is one of the first neurosurgeons in the Middle East and who was larger-than-life figure, certainly in Lebanon, and was an enormous influence on me as I went through my medical school at the American University of Beirut. But clearly from those days, America, as we called it, the United States, was a dream for all of us young people who wanted to escape the tragedies of the war and carry on our education elsewhere. And that's what I tried to do as far back as 1984, when I went through what was then probably, I think, the second year of the match program in neurosurgery. I think it started in 83. I did not make it through in 1984 when I tried to go through the match. Appropriately, I certainly did not compare at all with the quality of the wonderful US graduates. And then I decided to go to England, which is where I spent 4 years, from 86 to 1990. I tried again in 1989, the match program, and that year I was offered 3 positions outside the match, including Roberto Heros, who was then the chair at University of Minnesota, and I jumped on it.
So can you tell me, you mentioned a couple of people who really mentored you and influenced you earlier in your career. Can you tell me a little bit more about each of those and others that may have influenced your career early on?
Yeah. So Fouad Haddad was the first one, an exacting polymath, just created the field of neurosurgery in Lebanon. We would rotate, he'll come to round very early, like 5 a.m. on the dot, just such a revered figure. He was the first. The second one I must thank for, again, as all of us go through, we have people opening doors for us, which is why mentorship is so important in my life, on the receiving end and on the giving end as well. Alain Crocard in the UK, again, spectacularly elegant surgeon. He took me as what they call over there his registrar for 10 months. And just from that 10-month experience, he then opened the doors for me to the United States by writing to people when I applied for the second time. And of course, the biggest influence in my life in neurosurgery is unquestionably Roberto Heros, who I've known now since 1989, who I've had the pleasure of interviewing. I was in your seat interviewing him not too long ago here as a giant of neurosurgery. Really has become my big brother, having been my mentor, my teacher. Then the fellowships you mentioned, I had Art Day, Art certainly. I only spent 6 months with Art in Gainesville. I've learned many things from Art. He's a superb educator, but he certainly taught me how to think, for example, of aneurysms in 3D, how you clip them, and made me think properly about surgical technique, particularly for aneurysms. And then I spent my year with Robert Spetzler, and Robert is, of course, spectacular technician and judgment. And so, I mean, I can go on, but those are the formative mentors that I've had. And again, very important to mention that, and if there are young people watching this, mentorship does not stop with your fellowship. I mean, I've learned enormous amount from people well into my faculty years. Juha Hernisniemi, Evandro de Oliveira, Fred Gentili, and others. You keep picking things, not only technical things, but you just the different ways of approaching our complex field.
Maybe continuing on the discussion of mentorship, you know, I've always viewed you as a mentor, obviously, and a mentor to many, but really a dedicated educator, someone who spends a lot of time in your local roles, running the skull base and cerebrovascular program, running the cranial service, running the cadaver lab, and running your fellowship, but also nationally organizing and serving courses and the like. Tell me a little bit about what drives that passion for education and teaching the next generation.
Yeah, it is one of the main sources of pleasure that I derive, is to contribute to somebody's education. When I think back where that comes from, it's certain nobody's born with that desire to do it. I think those role models that I've mentioned, but particularly Roberto Heros, I mean, his style of teaching, and I think I'm emulating part of what he does, his dedication. I remember those 7 a.m. rounds, almost the Socratic method of teaching, the way he coaches in surgery. Very patient man. He would sit next to you, and he'll watch you on the microscope and say, you know, I wouldn't do that. Let me show you. Then he'll show you. Then he'll give you the seat back. That's very uncommon. Perhaps I'm not as patient as he is, but I certainly picked up, I think, that love of imparting whatever I think I have to the other generation. And to have, you know, whatever emails or letters or people coming to you in the conference say, Dr. Morcos, oh, this thing, thank you for, I learned how this and this from you, gives you pleasure.
Sure, sure. If you look back, on your career thus far, maybe name a couple of things that you really are proud of, or things that you've contributed. Are there things that come to mind in that area?
Yeah, I mean, on different levels, probably in organized neurosurgery. You mentioned the various roles. Thank you for using the word, I think you use the word ambassador. Yeah, I do think of myself an ambassador, not for the title, but for my ability to create bridges in this flat world of ours. And I think this is the role that I cherish the most, is learning from other parts of the world. We cannot be very US-centric. We should be open for a two-way communication and collaboration, and that's what I will certainly continue to do. I'm very proud that yesterday I was elected president-elect of this spectacular organization, and that probably will be the theme of my messaging in the year that I'm there, is the importance of being global.
Mentioning organized neurosurgery, and congratulations on president-elect of the AANS, and in all your past roles, really has been inspirational for many of us who are in that space. What drove you to participate in organized neurosurgery? What's the impact of you and others being involved in organized neurosurgery? And do you have suggestions or advice for young folks who might be interested in following that path?
Yeah, I don't know that everybody needs to do it, but it's certainly been an immense pleasure personally in my life to see other people rise, to emulate them. We need to better our specialty, and that is the way to do it. It's not simply technical things or basic or clinical science research things. By organized neurosurgery, you discover things that you didn't know existed. You discover the way to promote people who will benefit the field. This is not politics. It should not be confused with trying to be a politician simply to add another title to your CV. It's an opportunity to have an impact. And I certainly, the doors were opened to me again by my mentors, but primarily Roberto Heros. So as a youngster who didn't deserve to be on any of those committees, he would plug me in and say, this guy is great, you need to start. So I started my life in cerebrovascular, like you did, in joint section. And, and that's what I try to do for people that I think have potential in impacting our field. And as you well know from your own extensive experience in organized neurosurgery, it enriches us personally and enriches the field if we put the right people in the right positions.
Yeah, I find it, we all want to have impact, and that impact can be different for different people with different skill sets and different kind of aspirations. And some of that can be local and very individual to patients and families and things of that nature. And some of it can be broader impact. And it seems like organized neurosurgery for you is one of those areas looking for broader impact.
Yes, indeed, I agree.
So we'll shift gears a bit. You're relatively new, but very active on Twitter. I think we all enjoy the Morcos challenges and other kind of thought-provoking things that you put on social media. Why did you enter this space? And do you have any advice for those neurosurgeons that may be considering and maybe a bit intimidated to enter that space?
Oh, wow. No, I certainly don't consider myself as an expert, but the reason I entered the space is you have to thank the wretched pandemic of COVID that forced us to become virtual, as you know. It paralyzed travel and education, and so it was a very good way to reach people. I had no intention to get into social media, but then COVID really, and then I saw what other people were doing, and I said, wow, we can actually have an impact. We can teach, and that's why I got into it. It certainly was no attempt to advertise anything. And as you just mentioned it, I think last July, I started, when I've had kind of a reasonable amount of followers, I said, well, let's keep it interesting. So I started this Morcos challenge where, we put in a clinical case every day and get input. Again, certainly not to show off anything, and actually we've shown several complications, but it's just reaching out for everybody.
So Jacques, I've had the pleasure of getting to know you really well over a long period of time, and your wonderful wife, Fiona. I know you have 3 kids, Isabella, John, and Christina, and you're very proud and close to them. You're also a very high volume surgeon in a complex field with a lot of other local and national and international responsibilities. So maybe you could talk a little bit about how you make all that work and any advice for younger folks as it relates to work-life harmony.
Yeah. There certainly is no single formula that works, and I think each one of us should figure out what works for them in their specific circumstances. One thing that, again, I'm certain, and if Fiona was here, probably she certainly would say he's not perfect, and clearly I'm not. But one thing I do is I don't bring work home. What do I mean? It doesn't mean I don't do neurosurgical work at home, but when I come home, I don't usually talk about the day, because that precious time that I have with my family in the evening, certainly when they were young, now they're all out of the home, but it's Fiona and I only. But even from the earlier years, there's no neurosurgery talk. Fiona is a nurse. I could have easily discussed with her my day. That's the last thing on my mind to do when I got home, and certainly not with the kids. And weekends as well, of course, when the kids were growing up, trying to be involved in all their activities. But I did travel, as I continue to travel quite a bit, but that's kind of unavoidable if you are in organized neurosurgery, you are in global education. We will be out of the house for quite a while, and I don't know how to change that in retrospect.
Tell us about your hobbies. You have a lot of things that you like to do. I know about skiing and cycling, math, and traveling. Maybe expound upon that a little bit. And are there any particular synergies or any kind of things that you see connect with your professional neurosurgical life?
Well, you've mentioned the things that probably I barely have time to do outside my professional life. Yeah, I love my Peloton at home. I cycle more on my Peloton than I cycle outside, but that's maybe I should change that. But I love the skiing. Yeah, I do read. I love to read, various things, but I'm still probably a partial geek inside. I've always loved math and physics, and probably if I hadn't gone into medicine, neurosurgery, I just love the purity of those disciplines. Not that I can keep up with what's going on, but just seeing the beauty of those things. I like to read about them, and still to this day, when it relaxes me, I have no idea why. I'm certainly not a professional in those fields. It just, it gives me perhaps this window into a certain beauty of nature and of the human mind and the human creativity. It's a nice change from neurosurgery, but you did talk about synergy. People might think, well, they have nothing to do with each other also. No, this exactness, the way math makes you think about a problem, it applies very much to what we do. I probably drive my residents crazy talking about geometry and how it applies to surgery, simple things like the keyhole concept and the angle and the cone and why do you open the dura in a certain way, lots of math in there. Not advanced math, but lots of good math.
Yeah, I'm glad you brought that up. If you didn't, I was going to. That was the synergy that I identified, was your love of math and exacting science, and the way you approach anatomy, where it's precise. And I think that really impacts your teaching, the outcomes that you have. But I saw that synergy a little bit, so I'm glad you brought that up. You're an avid reader. You mentioned that. Anything you recently read that has impacted you that you might want to share?
I read it a while back, but it impacted me quite a bit. The book Flow, Flow, written by Mihaly, with an unpronounceable last name. He's a Hungarian psychologist, one of those names with full of consonants. I'm sure somebody will need to teach me how to pronounce it, but I call him Mihaly. I actually give that book to many of my interested residents. Very briefly, he talked about, he's actually did survey among happy professionals and figured out what creates happiness in the life of professionals. And I'm not gonna go through the whole thing, but there are 9 factors. And as I read this thing, and I said, gee, I understand why I'm a happy guy, because I am. I'm a happy guy. And he got it beautifully. He figured it out. So that's a book that stands out. And if you've heard some of my talks, I often put in that book in some aspect of the talk if it's relevant. Yeah.
All right. Well, thanks for sharing that. Just a couple more questions here as we close. You've kind of, I think, begun to enter a more senior stage of your career. And wonder if you have thoughts about that stage that you're in and what the future may hold, and then in particular, do you have thoughts for younger neurosurgeons, about, thinking intentionally about, this is the early stage of my career, and now I'm an established, and what are the opportunities and priorities at that stage, and now I'm entering a senior, and beyond stage, and maybe tailoring your professional and maybe personal activities related to that. Have you thought about stages of career, where you are now, and things of that nature?
Yeah, actually, I have not. You would think that somebody like me, who's very deliberate and precise and is mathematically minded, would have charted early on how I'm going to do things. And so I'm probably useless at teaching people that, because I didn't do it myself. I went with the flow in that sense. I certainly never planned, well, I'm going to enter this section, and from this section, maybe I'll be this committee. It may look like my life has been premeditated, professionally, I mean, but it actually hasn't at all. Again, I've had the good fortune of having good mentors. So I don't have a specific plan. I certainly, yes, I am senior, happy to be senior, but still with deep passion for what I do, and health permitting. I certainly plan to practice beyond 10 years from today, and we'll see if that will be possible. But you did bring up a very important point, is at some point in all of our lives as educators and neurosurgeons, you will get the feeling, well, it's not about me anymore. It's about raising other people, the younger faculty, and I've certainly arrived at that stage a while back now. So that's what I intend to do my remaining years, besides remaining very active surgically and on the international scene, is help elevate other people.
That's great. Maybe we could go back to the flow just for a little bit, this may or may not be related, but I think it might. One thing I was struck by, and I speak highly of you in terms of a surgical quality, outside of technical prowess and deep understanding of anatomy, but it is this equanimitas that you have throughout the day, especially in the evenings for longer, complicated cases, and when complications occur and things of that nature. I just was always struck by how you were able to keep calm and kind of continue to go about your business in an unhurried and respectful and an effective way. And any thoughts about where that comes from, or is that just natural, or did you learn that from someone? Where did that come from?
There is not, most of what we become is not nothing we're born with, I don't think. I mean, beyond the obvious genetic things that are the traits that you recognize in people. It probably goes back to the war in Lebanon, to be honest. I lived in it 11 years. It lasted 15. I lived 11, then went to England. And we lived every day as if we were going to die today. A bullet might hit you, a bomb might fall in. And you develop a thick skin. If you're still alive, you develop a thick skin, and then you develop this sense that, well, if if I survive today, well, everything else will be so much less threatening. So this is probably what makes me sail through, I make it sound very simple, it's not, but sail through what we consider are daunting tasks in neurosurgery. I very often in my mind, I'm in the middle of something and I think of the really terrible days of the Lebanese war. And I say, well, this is nothing compared to what I lived through or lived through before. It probably comes from there. You reminded me of something too. What I used to think about is, for example, when my kids were young, I would be in a tough part of a case. I might think of Lebanon, but I might think, well, whatever's going to happen at the end of today, I'm going to go home and Christina or Isabella or John, but usually it's Christina is the youngest, she's going to run to me and she's going to say, hey. So those things that keep you going, you know.
Yeah, that makes sense. That's great. Let me come back to Global Ambassador of Neurosurgery, which I really like that title, whether you accept it or not, but I like it, and I think it embodies who you are, especially at this stage. You mentioned it a little bit earlier, but maybe you could expound upon it a bit more. Why is that important? I know the WNS, is leaning on you and others, but you especially, to make this push towards connectedness across the world. You think, why is that important? Do you think that's particularly important in this era that we're living through right now in history and so forth?
Unquestionably. I'm finishing this week my 1-year assignment by Anne Stroink of being the director of global strategy, and I had a very nice committee of 8 people to work with, and we drafted, it was approved by the WNS board in November, we drafted our suggested vision for what the WNS should do globally. The WNS never really had an articulated vision. We certainly had lots of international initiatives, but this document we put together, I think, embodies what the WNS is all about. And of course, you mentioned why do that? Again, the world is flat and we cannot live into our silo, even though our silo is pretty huge, WNS, North American Neurosurgery. The silo should not exist, and there should be no borders to education, to mentorship, and so many other things. And by reaching out and learning and teaching, it's not just a one-way teaching of the rest of the world. We just enrich, going back to a theme we talked about earlier. It enriches us personally as neurosurgeons, as human beings, and it benefits the world. I mean, just think of what our less fortunate colleagues, neurosurgeons in some very underserved areas in Africa, I mean, what they would get from an open door policy to what we in the WNS have to offer. Just one of many examples.
Mm-hmm. Well, the time is coming to a close. We've covered a lot of topics and heard a lot of your background and insights and how you've contributed to the field. Anything we haven't covered that you'd like to mention? Or
just encouraging people who love neurosurgery, who know what they can bring to the field, to get involved in organized neurosurgery. There are many ways to do it. Committees, task forces. We all have individual gifts, talents, expertise, and please join. Don't live in your own silo. You will be surprised what you can bring as a gift of your own self to the rest of the field. But it does require that you have passion in your heart to be able to do it effectively. Don't do it just to do it. Do it if it gives you pleasure. Otherwise, you will not be happy.
Yeah. Well, Jacques, thank you so much for spending the time with us today. Thank you for the impact that you've had on my career, the impact that you've had on cerebrovascular and skull-based surgery. I think you're really a beacon for all of us to look up to. Thank you for your leadership within organized neurosurgery. a platform that I think you've used to better the field and better the care of our patients. And thank you for your role as the global ambassador to neurosurgery. I can't think of anybody else who does it better. So it's been a pleasure speaking with you today, and really hope that we have more opportunities to share and converse in the years to come. So thank you.
Thank you so much, Greg, for doing this. Thank you.